Hello. Here's a very common question that I'll get in one of the Facebook groups that I run from a real, a real patient, a real person that's wondering about this because it is very confusing. So this person obviously has somehow they've probably got an MRI to some degree because they're using the right words, right? I've got a herniated disc L5S1, so they know the location. Now they also know that they have pain that runs down one side. So very common when you have a herniated disc in that area, it's poking through, occupying space it doesn't belong in. And it's likely hitting a nerve root or putting pressure on a nerve root, causing that pain to go like down the back of the leg to the knee. That's called radicular pain. Sometimes it goes below the knee into the foot. In this case, L5S1 typically will go, if it's more of an L5 nerve root, it'll go more to the big toe. If it's more of an S1, it'll go more to the outside of the pinky toe or kind of to the back of the on the bottom of the foot. So, what can I do to help with this painful problem? And it's very painful. The first thing is understanding about the things that make you better and worse. So not everybody's the same. There's no standard or 100% thing that, if I have this diagnosis, there's a standard of care that will fix this. That's not the case with mechanical pain and mechanical disc issues in the spine. There is no standard. It's different for every person. So first we kind of have to ask and think about, am I better or worse based on positions, movements, time of day, activities, that kind of thing. So most people will feel a little worse with too much sitting, too much bending, rising from sitting, first thing in the morning, and they'll feel better with a little bit of movement, some walking, trying to stay active, changing positions frequently, and that gives you some clues to directional preference. So if that's the case, the first thing I would have this person do is work on one, their sitting posture. Make sure that when you're sitting nice and tall with a little bit of a lumbar roll so that you have that curve in the back. We want a little bit of extension in the back. If that's a positive sign in the sense where, my leg feels better when I sit tall, I sit straighter, my leg feels better, then the next thing we want to do is to work further into extension. The easiest way to do that is to go ahead and take body weight and gravity away by lying down. So picture me I'm lying on the floor right here, face down, hands low. And so when I first press myself up and come back down, there's going to be a pinch and it might kind of hurt the lower back and leg a little bit. But when I come back down flat, it goes away. So try it again. So you press yourself up higher, 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 and then come back down. And keep working into extension as long as the pain, temporarily, you can kind of feel it when you do it, but then when you stop and you calm back down to flat, it calms down very quickly. The next thing would be to stand then and retest all of your motions. So keep in mind three things. Pain location. Is it out of the leg? It was to the knee and now it's only to my hip, or maybe it's only in my lower back and it's completely out of the leg. Very good, positive sign. Pain intensity. Maybe it was a 6 and now it's a 4. Also a good sign. And then third, mechanics. How do I move? Can I move my hips easier to the left, easier to the right? Can I bend easier? Can I stand easier? All those things are things to think about when we're talking about mechanical cause and effect. If just doing that direction, that motion, that exercise give me an actual mechanical and symptomatic benefit. And you always got to think that way, whether you're going to a physical therapist or a chiropractor or a clinic, something where you find something on the internet. There is no 100% exercise that's all the way good or all the way bad. So you're always thinking to yourself, when I do that, not necessarily how it feels while you do it, it's the net result. How do I feel after? And if you want a better plan or a more complete plan, I hope these tips help you. But if you're looking for a more complete plan on getting back to your 100% feeling back to your normal self, drop me a message and we'll get on a call and we'll figure out how to best help you.